Hello, my name is Ikram Nibir. I'm one of the third year internal medicine residents at Florida Atlantic University. I'm going to present a case about renal vein thrombosis in a healthy young woman. We had the pleasure of meeting this 21-year-old female with no significant past medical history who came into our hospital with left severe flank pain that was radiating down to her left groin. She denied any fevers, chills, or urinary symptoms. However, the patient did say that she was having some associated shortness of breath for about a day, which was considered about the same duration of time she had this left flank pain. On physical examinations, there was nothing really pertinent in her exam other than the left severe tenderness. On further workup, she was found to be positive for a urinary tract infection with E. coli, which was appropriately treated with antibiotics. On imaging, we had a CT abdomen and pelvis with and without contrast that was done to figure out this cause of severe tenderness, and we noted that there was left kidney was having some perinephric fluid and stranding, reflecting evidence of pyelonephritis. The radiologist also commented about a possible thrombus within the left renal vein. As you can see in figure 1, there is fluid around the kidney and the left renal vein does seem very engorged. We further worked that up with the CT angio abdomen pelvis. As you can see in this transverse view, there's clear evidence of left renal vein thrombosis here, and we added figure 3 with a coronal view showing the same persistent left renal vein thrombosis. For management-wise, we quickly started the patient on heparin drip and consulted interventional radiology, vascular surgery, and nephrology to have their input for possible intervention. After further discussions with the interdisciplinary team, we figured that conservative management for this young, healthy female was probably the way to go, and she was keen to leave the hospital as soon as her pain abated within a couple days. So she was discharged with appropriate full-dose anticoagulation with Eliquis and appropriate oral antibiotics to treat her pyelonephritis, and she was asked to follow up with hematology oncology outpatient to further complete her workup for this left renal vein thrombosis. During her time here, we did have the opportunity to work up the possible risk factors. As we know, causes of renal vein thrombosis mostly are from either nephrotic syndrome, malignancy, or any other hypercoagulous states that the patient may have. There was no significant family history of any clotting disorders, and we did check a urine for any proteinuria, and she did have no protein spillage in her urine, and the imaging that we had so far suggested no signs of tumors or any malignancy in her body. We did have the chance to get some hypercoagulable workup done. Cardiolipin, beta-2 glycoprotein antibodies were negative, ANA was 1 to 80, rheumatoid factor was negative, PNH colon and myeloproliferative disorders with JAK2 mutations were also negative. Studies that are pending are antithrombin 3, prothrombin levels, factor V Leiden, lupus anticoagulant studies. We were discussing as a team about her potential causes or risk factors for clot formation, and we kind of deduced that assuming that her hypercoagulable workup would be negative, we can hypothesize she probably had the perfect convergence of risk factors that kind of had the propensity of making a clot in her body. Essentially, we view the pyelonephritis as obviously an infection, which obviously disrupts the laminar flow of the blood vessels, causing a nidus for clot formation. Also, the inflammation associated with it increases propensity for the clot formation. She also had a recent change in her oral contraceptive, which we know is a risk factor for clot formation. She also had a recent travel within the last week of her presenting symptoms, about 8 hours long of duration of flight, and with the chronic history, we felt as if all of these factors were contributing to Virchow's triad and eventually culminating in this development of renal vein thrombosis. Thank you for letting me present this case, and I hope you learned something and thought this case was really interesting. Thank you.